Bowel cancer is cancer of the large bowel, the colon and the rectum, so colorectal cancer. About 1 in 20 people will be diagnosed with colorectal cancer at some point in their lives, usually as they get older. It's the third equal most common cause of cancer in the UK and the second commonest cause of cancer death. Having a positive family history, others in your family who've been affected, being overweight, not taking a lot of exercise, drinking too much alcohol, having inflammatory bowel disease, all increase your risk, where eating lots of fruit and vegetables and taking regular exercise can help protect you. It's really important to be aware of what the symptoms are, because the earlier you seek help about them, the better your chances. Those symptoms include a change in your bowel habit, often towards more frequent or looser stools, but it could be the other way. Blood in the stool, which could be dark red blood mixed in with the stool, or black, tarry stools, occasionally bright red blood on the paper or on the pan. Feeling generally unwell, being off your food or losing weight for no apparent reason, and feeling generally tired. We do have screening programs which can greatly reduce the chance of you developing bowel cancer and can mean you can be picked up earlier and treated, so your chances of survival are better. They include something called a fecal occult blood, which is offered every 2 years between the ages of 60 and 74. The invitation comes through the post for you to take a tiny sample of poo, and a one-off scope screening, which is being rolled out across the UK at the age of 55. Treatment will depend on what's been found in investigations. So colonoscopy is usually the way that the tumour is found and a sample is taken of it, but you may have other investigations such as a CT scan or an MRI scan to see if it's spread. And the treatment may involve surgery, especially if it hasn't been found to be spread. You might end up with a colostomy bag as a result, or a temporary one which can be reversed later. But also chemotherapy and radiotherapy can be used to treat it. If it's diagnosed at the first stage, the earliest stage, more than 90% of people will survive a diagnosis of bowel cancer long term. Unfortunately, that's only 1 in 7 people who are diagnosed at the moment, which is why screening to pick up things early and being aware of your symptoms and getting them checked out is so important.